Hello, everyone. Welcome. We'll just wait a couple more minutes to allow more participants to join. We'll begin shortly. Good afternoon, good morning, and good evening to everyone. We welcome you all, particularly those of you joining from far away or at late or early times. Thank you for joining this WHO EPI-WIN webinar on the launch of MERS Tracker, an interactive dashboard to support evidence-based decision-making. For those new to EPI-WIN, this is the WHO Information Network for Epidemics for Science and Knowledge Translation in Health Emergencies. Our goal is to translate science in accessible, understandable, and relevant ways for evidence-informed actions and decisions in health emergency preparedness and response. My name is Sophia, and I will be hosting today's webinar. We have a great panel of experts today to discuss the MERS tracker. They are Dr. Maria Van Kerkhove, Director of Epidemic and Pandemic Prevention and Preparedness at WHO. We have Dr. Madhur Dhingra, Lead of Animal Health Prevention, Preparedness and Response at the Food and Agriculture Organization. We have Dr. Sophie von Dobschwitz, Technical Lead of MERS-CoV at WHO. And we'll have Mairead Whelan, Sero Tracker Co-Lead of University of Calgary. Harriet Ware, Sero Tracker Researcher of University of Calgary. And Alice Simnisonu, Epidemiologist of Emerging Diseases and Zoonoses Unit at WHO. Before we proceed, here are some housekeeping and reminders. This webinar is being live streamed on EPI-WIN YouTube channel. The webinar is being recorded, and afterwards, the recording will be available from our website, and the address will appear in the chat. And we invite you all to post your name, location, and organization in the chat box. We would love to hear where you're joining us from. And please add any questions you may have to the Q&A box, not in the chat, so we can more easily keep track of them. Without further ado, let me now welcome Dr. Maria Van Kerkhove for the opening remarks. Maria, the floor is yours.
Thank you so much, Sophia. Thanks to you and Supriya and everyone behind the scenes for all of the work that you do on EPI-WIN and for helping us to host this MERS EPI-WIN seminar today. I'm thrilled to be here. MERS is very close to my heart, as I was the former MERS technical lead before the COVID-19 pandemic, and very gratefully handing over to Sophie von Dobschutz, who's joined us a few years ago, previous to FAO. So thank you so much for joining us today. As you said, I'm the acting director of the Department of Epidemic and Pandemic Preparedness and Prevention. The Emerging Diseases and Zoonoses team that sits in my department has been tasked with developing strategies, evidence-based guidance, global mechanisms, and interventions to address high-threat pathogens with epidemic and pandemic potential. Our mission is to minimize the impact of these threats on affected populations and limit their international spread, where we can, to prevent these outbreaks and epidemics from happening in the first place. The COVID-19 pandemic highlighted the threat posed by coronaviruses and the critical importance of preparedness. One of the ways in which we do this is to gather all published evidence in order to make better evidence-based decisions. This informs our guidance, our trainings, our strategies, and our prevention. And as evidence gets updated, we update all of our guidance, our trainings, and our strategies for prevention and also response. We're really excited today to present the outcomes of a very fruitful collaboration with the University of Calgary, their Sero Tracker team, which you will hear from later today, which we established during the pandemic. Some of you may be very familiar with our COVID Sero Tracker tool that we jointly developed during the pandemic. Today, however, we're going to focus on another coronavirus, the Middle East Respiratory Syndrome coronavirus, or MERS-CoV. It's a zoonotic virus that's transmitted to humans from dromedary camels. This is why this time, together with the University of Calgary, we joined forces with FAO, the Food and Agriculture Organization, and thank you so much for joining us on this webinar today, to build a comprehensive dashboard displaying published MERS-CoV studies, and we name this the MERS Tracker. This platform presents the aggregate results from virologic and seroprevalence studies or field research in both humans and in animals. We believe that this tool will be very valuable in informing decisions regarding the implementation of surveillance and other early warning and prevention measures against MERS-CoV. By putting all of this evidence together across vast geographic areas where positive serological or virological results have been reported in either humans or animals, awareness can be raised locally for the risks in terms of prevention, but also for decision-making processes that can be enhanced. We hope you'll find this tracker useful, and we welcome any feedback that you have and any suggestions that you have for further improvements. It's a work in progress, and it will be updated as more evidence becomes available. Thank you so much for attending this webinar, and thanks so much to, I have to say, my own MERS technical teams that sit here in HQ, but I'm also very grateful for the regional work, our regional office colleagues, our country office colleagues, the work that we do across many of the different ministries, not just in human health, but also across the agriculture sector, wildlife, environment. We can't do any of this without the partnerships that we have in country and across different sectors. And again, this is another illustration of why the One Health approach is so important. So thank you so much for joining. Thank you so much to all of the teams that were involved in this and for all of the partners for advancing this work. Back to you.
Thank you very much, Maria. And now let me invite Dr. Madhur Dhingra for a introductory overview. Dr. Madhur, the floor is yours.
Thank you. Good morning, good afternoon, good evening, everyone. And thanks, Maria, for those very nice opening remarks and setting the stage. So today we are very excited to announce the launch of the MERS Tracker dashboard. And this is a joint effort by FAO, WHO, and the University of Calgary. And really, this tool exemplifies how collaboration and innovation can help tackle some of the most urgent global health challenges that we face today. So FAO has been working with WHO for global health security, along with their other partners, for many, many years. Since 2016, FAO has supported countries in the Middle East and Northeast Africa for doing surveillance and field studies and other activities related to MERS. And these activities had been supported by USAID support through their different projects. A lot of these activities involved, how MERS coronavirus spreads between camels. They included mapping and analyzing camel value chains, carrying out participatory disease surveillance, supplying lab equipment, consumables, and also providing training to improve laboratory and epidemiology capacities. So all these efforts resulted in improved MERS coronavirus surveillance in the countries in the Middle East and Northeast Africa regions. And all this data laid the groundwork for better prevention and control. So one of the consistent needs that has been identified by countries is, improving the interoperability and data integration and data sharing, especially between animal and public health systems. So the MERS tracker addresses this gap by consolidating data from the human and animal published viral and seroprevalence studies into a single accessible platform. So this helps to expand our knowledge of the disease, but also supports evidence-based decision-making by providing reliable data for countries and the scientific community. So at the global level, FAO has been a leader in developing early warning systems, data management systems, and tools. And all of these have enhanced risk monitoring, forecasting, and preparedness for various kinds of diseases. The MERS tracker is really building on a lot of these experiences, and it offers a model that can be replicated for other zoonotic diseases and other high-impact animal diseases as well. In fact, we will be using it for other animal diseases as well. And we hope that by connecting the MERS tracker to other platforms like FAO's Global Animal Disease Information Database, EMPRESSI, we can generate real-time actionable information that can help countries to manage risks, prepare for outbreaks, and respond quickly to emerging threats. We'd like to highlight our critical collaboration with WHO over a long term. We work with them not only on MERS, but on many other pandemic risks. And working together ensures a coordinated response to zoonotic disease threats. And it helps us to combine our expertise to maximize the impact. So this partnership really exemplifies how the One Health approach can create stronger, more integrated initiatives to address all these challenges to global health security. And I'd really like to thank the teams at both FAO, WHO, and the University of Calgary for pulling all of this together and bringing it to fruition over here. With that, I hand it back to you, and thanks once again to everyone.
Thank you very much, Dr. Madure, and to Maria for your very nice introductory remarks and for highlighting the importance of the MERS tracker. Next, we will have Dr. Sophie von Dobschitz, technical lead of MERS-CoV at WHO, who will tell us more about the Sero tracker tools. Dr. Sophie, the floor is yours.
Thank you so much. Good morning, good afternoon, good evening, everyone, and thank you for joining us. So I will present you a little bit the story behind the MERS tracker, and it's important why we decided we need one. And to do that, I give you a little bit of background on MERS-CoV for those of you who are not so familiar with the disease. So this is a virus who is one of the high-impact coronaviruses that have emerged in recent years. It's a beta coronavirus. It is zoonotic, as you heard. It can be transmitted between animals and humans. It has pandemic potential and was first identified in the Kingdom of Saudi Arabia and in Jordan in 2012 in human cases. Then dromedary camels were confirmed as the reservoir host through intensive One Health investigations. And to date, actually no specific therapeutics or vaccines are available or licensed, although that is work in progress. And so this makes MERS-CoV one of the WHO priority pathogens for research and development. So I told you about the camels being the reservoir. Camels actually don't show any clinical signs, or if they do, only mild clinical signs. So it's very difficult to understand if they're infected or not. And that also means that we have very, very few camel outbreaks reported to the World Organization for Animal Health, although it's a reportable disease because it's just not being picked up. From camels, we have sporadic spillover to humans. And then we may detect a case, and on the graph you see these detected human cases in red, or it also may remain undetected in humans because they also could only show mild signs or be asymptomatic. Then we've observed in the past human-to-human transmission in healthcare settings and communities. That's the red clusters you see on the graph. However, the good news is while we see sustained transmissions in animals, to date, there's no sustained transmission in humans, but obviously this is one of the big concerns that the virus could change and mutate to become more transmissible also between humans. This is the WHO MERS-CoV global epidemic curve. And you see this curve depicts the time from the emergence of the virus in 2012 until almost now. These are only human cases. You may see these very, very high spikes that we observed in previous years. These are related to huge hospital-related outbreaks in humans. happening in the Arabian Peninsula, but also happening in other countries. For example, in red, you see an outbreak highlighted for the Republic of Korea. And this outbreak happened through a traveler case who was exposed in the Middle East and then traveled to Korea, where he was hospitalized and then sparked this huge outbreak. Since then, you see the spikes thankfully going down. This is due to improvements in the infection prevention and control measures in hospitals. So great strides have been made. And to this date, we have 2,615 cases officially reported to WHO. 943 died, which made a crude case fatality rate of 36%, which is actually quite high. But you have to consider, as I mentioned previously, that we might miss in this case count some of the asymptomatic or mild cases that are not being reported. So this is probably an overestimate of the case fatality rate. However, it is quite significant. This is a very nice graph that FAO prepares. This is human cases, but by exposure source in percentage. And you can see a recent trend towards predominantly sporadic primary human cases that could be either with reported camel exposure, and that's seen here in red, or without reported camel exposure, but no reported human exposure, that would be depicted in yellow. In blue, you see secondary cases. So these are the human-to-human cases where these are not zoonotic cases, but human infection cases. And sometimes we have no data available. And you can see how this percentage changed over time. And so if you remember the curve I just showed you, how the spikes go down and the number of cases reported go down. So we have fewer cases reported in recent years. But most of these cases are actually primary. That means they don't have any known human-to-human transmission. And since camels are very important in the epidemiology of this disease, and especially the generation of the recent human cases, it is, of course, also important to capture the virus circulation in camels. And you might have been wondering about this very last period, which is the past 1 year. Where we again see human-to-human transmission. And if you look at the little timeline that I just added, this is actually a very small cluster of human-to-human transmission that happened in KSA earlier this year, where we had 3 people connected in a small outbreak. And this just serves as a reminder that these small outbreaks are still happening. So we should never let our guard down. It's very important to always be prepared and be able to curb these outbreaks as they come up, in order to prevent any of these larger infection events that we've seen in the past. So the name says Middle East Respiratory Syndrome because this is the region where we see this virus endemically circulating in camels with sporadic but regular spillover to humans. So all the human cases that have been reported in recent years were from that region. You see it here depicted in dark red. I mentioned the traveler cases. We've seen traveler cases in the past, and sometimes causing onward human-to-human transmission in the countries they travel to. So these countries would be depicted in blue. But then if you look at all the countries colored in these different shades of brown, so these are countries where camels are present. Some of these countries have had studies where we could find evidence of circulation of the virus in camels, and some studies even evidenced a spillover from camels to humans, either serologically or virologically. And so these are very, very important events that we also have to consider when we make our decisions. And this is why we cannot really only rely on the information that is officially reported, which would here be the sort of tip of the iceberg. Those cases that are laboratory confirmed, that usually have clinical symptoms, that's why they're being picked up in the first case. And these are the cases officially reported to WHO. But actually, the bottom of the iceberg are all these underreported cases that are either mild or asymptomatic, or where you need to conduct targeted studies to actually find them. And so this information can be generated by serosurveys and research. Again, a map that FAO prepares and that can be found in their monthly MERS-CoV update. And it's very nice because it shows the modeled camel density as a background layer. And on top, the circles depict in which countries research has been conducted. The bigger the circle, the more studies have been conducted. If the circle is yellow, at least one of the studies found a positive result in camels. So these are only animal studies. But you see how important it is to actually understand the whole geographic distribution of the virus. It's far, far, far beyond just the Middle East. And this inspired us to, so this is a static map, but this inspired us to look at the MERS tracker dashboard that was prepared in the past for diseases like COVID or arboviral diseases, because we thought this is exactly what we need. And of course, we want to go beyond just studies in animals. We want to actually have a comprehensive dashboard that looks at animal and human studies. It should be interactive, not static, so that people can access the studies in question and can also download maps and graphs that are presented on the tracker dashboard. And you'll see that in a minute. Very exciting. And the user can also download the whole list of studies that are depicted on that dashboard. This is something for the future, but we're planning to have the dashboard really up to date through regular automated literature searches, so that the user has a one-stop shop for the latest research and all the research ever conducted on MERS-CoV, looking at virological or seroprevalence in animals or humans. And with this, I thank you for your attention, and I would like to hand over to Mairead Whelan and Harriet Ware from the Sero Tracker team at the University of Calgary to show you the dashboard itself. Thank you.
Thanks very much, Sophie. I'll go ahead and share my screen. All right, hi everyone. My name is Mairead Whelan. I co-lead the Sero Tracker project at the University of Calgary alongside my co-lead Harriet Ware, who will be presenting the second half of this presentation. Thank you everyone for introductory words so far in this seminar, setting the stage about the importance of MERS-CoV, gathering serosurveillance and published research studies, and how this can contribute towards decision-making. So before I get into the MERS Tracker dashboard, I just wanted to give a little bit of context of who we are, the Sero Tracker group. As Sophie just outlined, the importance of seroprevalence data and these kind of data we can draw from published studies really represents an important reservoir of information for addressing a pandemic. As we saw during COVID-19, seroprevalence data in particular was a really important resource. However, the issue with this kind of data in particular, and often we see in other EPI estimates, is that this data is often largely and only sometimes accessible through independently published research studies, which means that they're scattered in various different sources and therefore difficult to harmonize and bring together to use for decision making. So that's why we made Sero Tracker, is to create one harmonized resource for researchers and decision makers to access these information in one place, these pieces of information in one place. We did this by conducting the largest living systematic review of its kind for SARS-CoV-2 seroprevalence studies during the COVID-19 pandemic. So we screened hundreds of thousands of abstracts on a regular basis. On our SARS-CoV-2 dashboard, we included studies from over 4,500 studies, millions of participants. And uniquely, what we then did is we pipelined this data onto our interactive serotracker.com dashboard for COVID-19 seroprevalence studies. So this is not the first time we've worked with WHO. As noted by Maria earlier, we were very happy to work with WHO visualizing the Unity studies for this initiative on serotracker.com. We can explore, download, and visualize that particular kind of data set. And you can actually access our SARS-CoV-2 Sero Tracker on the WHO COVID-19 dashboard. And we presented this data in a number of instances to a variety of committees. I also would like to note that in our serotracker family, we also have a dashboard for arboviruses, including 6 pathogens. That follows a similar concept, tracking seroprevalence studies. I do want to highlight here that our Arbo tracker and arbovirus dashboard is not formally affiliated with WHO, rather a collaboration with the various logos and people displayed at the bottom of the slide. But I did want to point your attention to that just in case we have any arbovirus interested people in the audience today. That brings us to why the topic of the seminar, however, is introducing our newest dashboard in collaboration with WHO and FAO, focusing on MERS-CoV, which we're very excited to share with you today. So for those of you who might have been familiar with serotracker and our other previous existing dashboards, you might be asking, okay, what's different, what's new about this MERS version besides being a different pathogen? So for the first time, we have included studies beyond seroprevalence studies, including viral and PCR testing and studies including genomic testing, because it is so important to capture that full scope of the disease and the various metrics we can measure it with. We're bringing One Health to the forefront now for the first time also, including studies in both animal and human populations to understand the scope of infection across these important reservoirs for the zoonotic disease. We created new filters and visualizations tailored to unique MERS use cases in consultation with WHO and FAO, lab and research experts, academics, on-the-ground researchers, and relevant policymakers and Ministry of Health members. We also included and either included or are in the pipeline to include very soon map overlay features with WHO and FAO data to further explore the context of this data. So now I'm going to do a bit of a live walkthrough of the website. Perhaps it's possible that one of my colleagues may be able to drop the link to the website in the chat or the Q&A, in which case I welcome you to open it up and follow along. I also have the link here for you at new.serotracker.com is our main dashboard. From there, you'll be able to access the MERS dashboard. Without further ado, I will bring us to the dashboard. So when you arrive on the MERS tracker dashboard, this is the first thing you will see. It's our pop-up disclaimer. I do want to spend just 1 second discussing, talking about this. So this disclaimer just tells you what we do, which is display published and publicly available MERS-CoV serosurveys, viral testing, and genomic sequencing studies, where we compile and centralize these resources. I do want to highlight that these data are extracted from already publicly available independent research, and we have not conducted a critical appraisal or risk of bias rating, as sometimes happens with systematic reviews for the studies on this dashboard. So as usual, when you're engaging with published research, they're heterogeneous and vary in their methodology. So please do interpret and compare with a mindful eye, as you normally would. That brings us to the dashboard, yay! So the first thing you'll see is, of course, a quick nav buttons that'll help you navigate the website, and the disclaimer again. But really, I just want to bring you right to our map, which tends to be the crowning jewel of our website that people enjoy engaging with the most. So when you land on our map, you'll see a number of different things. So first, I want to point out the data points displayed in these different wheels. The numbers refer to the number of studies in that region or geographical area. And the colors, according to legend here, refer to what kind of data we have. So blue is studies conducted in humans, with green referring to studies conducted in animals. So when you click on these wheels, it will zoom you in further so you can get more granular view on where these studies were conducted. When you hover over, it'll give you a quick summary of those data. And same if you click on a country, for example, we have Saudi Arabia here, it will give you a quick overview of the studies there. When you get down to an individual study level, which you can see by these single dots, you can click on that. It will give you a link right out to that specific study, as well as some summary metadata that we have pulled from that particular study. So bringing us back out a little bit, I'd like to show you this legend here. Beyond showing you the types of studies, we also have overlaid our map with camel population by country or area, which is data we collected from FAOStat and in collaboration with FAO. We will be including several exciting map layers, which Harriet will speak about later, which will be available by the Customize button on the top left-hand corner. I'd also like to note that we will be continuing to update the sources in here, and we do have a way for you to submit a source to us if you're browsing our database and notice a study that you think should be included on our dashboard that isn't yet. Please do send it to us via this form, and we'd be very, very happy to include it or assess it for inclusion and have it appear here. Moving over to the left-hand side, we have a number of filters now that you can use to actively explore the data in our database according to your particular interests or needs. So first of all, we have filters according to human and animal data, which you can toggle on or off depending on what particular data you want to see. Here, I'm just now focusing on animal data, and now you can only see the animal data displayed in the dashboard. But you can also use it for more specific drilling down in the database to see exactly what you're looking for. So say you wanted to see exactly, particularly only studies in Saudi Arabia, because that was an area you were interested in, just as an example. And now we are zoomed in here and you can see those studies. Now, perhaps you were particularly interested, you only wanted to see studies that sampled using an ELISA assay for seroprevalence. Now we've drilled down even further and only have those studies available. So you can see there is 8 studies that meet your criteria for those filters that you can now explore. You can reset the filters at any time at the bottom. And then let's go through another few examples. So in our filters, we also include sampling date, sampling method, more information on assays, specimen type, sex, isotype, and antigen. But we also have particular filters that we developed according to what might be important when looking at these either human or animal estimates. So under the animal estimates, we have animal type, species, sampling frame for the animal population, imported or local, and some information on clade. Under human estimates, age group, sample frame, and exposure level to camels. So say you were interested in studies of sampling high-risk populations that were occupationally exposed to camels, say perhaps exclusively slaughterhouse workers. Let's zoom out a little bit on the map so we can see all the studies here. Say you just wanted to look at slaughterhouse workers. Now we've drilled down the filters to see this. Perhaps you wanted to see all of the high-risk populations instead, and we can do that. So that's our map, but we also have other ways to explore our data. We have our data as well displayed in an interactive table format. Oh, I forgot to mention, but importantly, the filters on the left-hand side, when you use these, they affect the data on our whole dashboard. So the filters on the side will also apply to this table. It just depends on preference and how you prefer to visualize it. Some like the map, some like to see it in a table. So you can customize your table, of course, using the filters on the side, but we have a few presets here with interesting information you may want to explore. You can also, once you've downloaded, created your custom cut of data, you can download that data as a CSV, cite us, access our data dictionary for more information, or add or remove columns to really get a picture of the data that you're interested in seeing. Next, we have a few interactive visualizations, again, modifiable by the filters. And we have a few drop-down options looking at different populations, types of estimates, that you can see either by assay classification using screening or confirmatory assays, and grouped by different regional areas. So here we display, this is a map on human seroprevalence. If you hover over, it will give you the study data for that study point so you can explore. Lastly, we have a data some bar graphs, a similar interactive visualization, also with drop-down options here for you to explore the data. And if you wanted to download these customized visualizations, you can download them here and include them in reports or other presentations. If you'd like more information on how we curated and accessed our and put together our data, protocols, and the team behind us, you can go to our About page about our data and FAQ for more information. And now I'm very happy to hand it over to Harriet, who will continue our presentation and talk more about some specific use cases you may be interested in.
Right. Hello, everyone. So the first and perhaps most important use case that we'd like to highlight is vastly increasing the efficiency to complete a literature review for your report, paper, or policy brief. So using our filters that Mairead showed, you can select the type of surveillance study and options such as sample frame, country, or type of assay to immediately generate a data set of studies targeted at your niche area of interest. This data set can then be reviewed in the website in the data table or downloaded as a programmatic Excel sheet to run further analyses on. Second, a unique feature of our platform, as we mentioned, is the genomic sequencing data table, which allows users to track and compare studies that sequenced the MERS-CoV full or partial genome. So we currently provide centralized information for these studies on the genome coverage, the circulating clades by region, and the GenBank accession numbers for further analysis. And as we collect more studies in this area, we may add further visualizations or analyses. Now to go into the visuals in a bit more detail. So using this graph that we showed, users can quickly summarize the estimates and confidence intervals of MERS prevalence detected in individual studies and visually assess the amount of study heterogeneity and outliers across key variables. So for example, you may want to compare human versus animal seroprevalence as displayed on this slide. We see there's quite a large contrast with most human seroprevalence estimates near zero and quite a wider range of animal seroprevalence estimates on the right. You can also compare across different populations using the drop down in this graph, like the general population, persons occupationally exposed to camels, healthcare workers, and suspected cases. So the data displayed here is customizable using the slide and graph filters and also downloadable to share in a report or brief. And each estimate is clickable to easily get more information on any estimate you see here and link back to the original study. And also wanted to mention in these graphs, the estimates are automatically grouped by type of assay. So for seroprevalence studies, they're grouped by studies that used only a screening assay such as ELISA and should be interpreted more cautiously versus studies that used a neutralizing assay to confirm positive results as recommended by WHO. And for virological studies, grouped by PCR assays. So on the last use case we wanted to highlight, so tying back to the static map that Sophie showed, if you're looking to identify surveillance data gaps and where future studies are missing or needed, you can visualize where studies have been conducted against exposure risk using our map tool. So currently exposure risk is represented using camel population data from FAOStat, as we mentioned in red, with higher population indicated by darker shading. Compared to where camel and human studies have been conducted using the data wheels. And this leads into our future development. So first, we wanted to mention that we are in the process of switching the camel population map overlay with modeled camel densities from FAO to show more granular and geographically specific data as shown on the map here in yellow. And we also intend to add more overlay options on the map, including, for example, reported human MERS-CoV cases. On the next slide, we have just a similar example from our arbovirus dashboard where we have a map overlay showing modeled environmental suitability for vectors. So you'll see something similar to this on MERS Tracker in the future. And then lastly, I just wanted to touch on some future directions for the project. So we have in the pipeline a new literature search with an updated search strategy to capture additional published sources, including sources that we receive from users submitted to our website. And then in collaboration with our partners, we plan to update this search annually or biannually, depending on the amount of data out there. We also welcome any requests for new dashboard features. And we are also working with WHO and FAO to formally meta-analyze the synthesized data in a joint paper on camel and occupationally exposed human studies. Finally, we have some exciting research ongoing at Zero Tracker, also related to this project and others, to harness AI to conduct automated literature reviews. So in our preprint posted in the summer, our initial prompting approach demonstrated very high accuracy applied to the abstract and full text screening process, approaching and exceeding 90%. And so showing an order of magnitude faster screening could be possible for future dashboard updates. So we're continuing to validate and extend this research to apply to other data sets of systematic reviews in various areas of research, and also to the full end-to-end systematic review process. And with that, that is the end of our presentation. We'd like to thank WHO and FAO for their support creating the MERS dashboard, and also acknowledge funding for Zero Tracker in the past 4 years from the Canadian Institute of Health Research, the Public Health Agency of Canada via the COVID-19 Immunity Task Force, and the University of Calgary, and some other partners and funders. Thank you.
Thank you very much, Harriet, Mered, and Sophie, for sharing with us this amazing new tool. Huge congratulations to the teams involved, and looking forward to the future features as well. And so it seems like we have a few questions in the Q&A box. Let me now invite Alice Simnusunu to facilitate the Q&A discussion. Alice, the floor is yours.
Thank you so much, Sophia. So I will try to get through all the questions in the Q&A box, but may not get to all of them. So just wanted to start off, and maybe I'll divert a few to Sophie. So start with you. So there was an initial question that was asking about how we can relate this to climate change. So there was the initial question. I think you have, sorry, 1 second. That there are countries located in a band where temperatures are quite high. So does that mean that climate change will be able to displace this area, and how that will affect what we are seeing for MERS? And then I have a few other questions as follow-up.
Sure, I'll start with that one. Thank you. That is a very important question. And of course, you're right. Looking at the band of countries that have been highlighted in the different maps. So this is where we find the camel populations. And of course, camel raising is dependent on certain climatic conditions. And the more arid the areas are, the best they're suited for camels. And given the climate change that will, increase this arid land area in the coming years and over time, we also expect the camel population to grow and to expand. So this is actually one of the future risks for MERS dispersion and increasing the MERS spillover risk, that we might see more camels in more areas because of these climate change effects.
Thank you, Sophie. And a few more just for you before I pass on to the others. There are some questions related to how how we plan to update the tool in the future, whether we will include also genomic data, wildlife data, and any other goals to include layers of reported human cases and deaths alongside from published studies. And in addition to that, do we plan to make any other diseases using this type of tool as well? And one example was given as rabies. Over to you, Sophie.
Yes, so thank you. Indeed, we have decided to be inclusive with this MERS tracker. So we are looking at any published study focusing on either serological or virological surveys in animals or humans. So these could be different animal species. In fact, you will see when you dig deep into our data that even some buffaloes mentioned, they tested negative, but you'll still find them there. So far, the research has not indicated any other animal species to be involved in the epidemiology of the disease. However, this could, of course, change over time, and it's important that we track these events and we track these findings, and indeed we're doing that. With regards to using the tracker idea for other diseases, of course. So you heard we started off with a COVID-19 tracker, and then we worked with the University of Calgary on a arbovirus tracker, now the MERS tracker. So there are infinite possibilities for the future. And you also heard from Madhur that even the FAO is looking at the tracker idea from the animal disease point of view.
Thank you. Sorry, there was one more that is particularly relevant to you, and then I will move on to the others. Do you have any plans, and how do you plan to measure if the dashboard is being used in country decision-making and driving actions in the human and animal health sectors? And which features would be the most useful for this for countries?
Yes, very good question. And actually, I forgot to answer one point which is the use of official data in the dashboard, right? I think you mentioned that in your previous question, sorry. So indeed, we decided that the tracker would focus on published studies and results from published studies. In the version you saw today, you won't find any officially reported human case data to WHO or animal outbreaks, which are very few reported to WOHA. But for the future, we're thinking of maybe including this as an additional layer. What is important to understand is that there's a difference between officially reported cases, which have gone through scrutiny. You know, they follow a certain case definition, they follow certain laboratory testing requirements that WHO and WOA provide, so we can be certain that these cases have indeed been MERS confirmed. Whereas for the research studies, and you find a big disclaimer on the dashboard, that actually the collaborating organizations, including the University of Calgary, we have not screened for the quality of these studies. They have been peer reviewed, so we just collect what is available in the public space. But by no means should this be regarded as officially reported data. It is just available in the public space, and we gather it because it's important for our decision making. And then to your last point, how we can measure if countries are using the MERS tracker. So right now, actually, it's a good point to think about maybe in future. Right now, this is the very first prototype that you are seeing today. We're very proud. We actually encourage you to share any opinions or suggestions for further improvement, and hope you will start using it. And please contact us if you have any good ideas. But in future, we will work with countries the tool is very useful if you want to know what's been going on, what has been found in your country in the past or in your region. So obviously, you know, there's always a delay from finding the results until they're published for research. But it is a good source of information for when you're planning your own studies. So you can make sure you're not duplicating with previous studies. You can get a good idea of what has happened and what were the findings in the past. And then you can target either your own studies, or maybe you want to start surveillance, or you want to introduce other risk mitigation measures like risk communication. You can target that according to the results from these studies. And this is where we hope this tool can be very helpful, not only for countries, but also for regional and global institutions to base their decisions on. Thank you.
And thank you so much, Sophie. Dr. Seck, please come in.
Yes, thank you so much. I would like just to complement and the point related to the use of this Zero Tracker at country level. I think from FAO side, as you know, this tool will help us to complement data we are collecting from animal health side, and this will also, as mentioned by Marur in her introduction note, to really better help to validate the forecasting model we have on MERS-CoV. It's really important in terms of decision making, and also that will help to update our prevention and control actions, and also better support in terms of communication and sensitization to our country. That's something for me that will make a lot of sense, that enhance our capacity to approach country to early alert for early detection of MERS-CoV in our at-risk country. And for us, it's something really good and complementing data we are collecting. And what is interesting is the link with our global early warning system we are building, and that is something really also very good. Link it to that one can help to better validate our forecasting model for MERS-CoV. That's additional information from FAO side on the use of this Zero Tracker at the national and regional level. Over.
Thank you so much. So now I will pass over to Harriet and Mayred. There are some questions for you that are particularly related to the data presented in the tool. So I think some of it was answered before, but what are some of the measures in place to ensure the accuracy and reliability of the data presented in the tool? And are there any efforts to incorporate real-time data into the dashboard? I think you've already answered a little bit about this, but if you could please touch on those as well, and then I will pass on to Sean for some programming questions. Over to you, Mayred.
Sure. So the first part of the question was on accuracy and reliability. So this has already been touched on already, but really the main purpose of this tool we're presenting today is really just to bring together the evidence that is available out there and provide that step in between going out and searching for it and possibly spending many hours conducting a background literature review, a narrative search to support your background sections, and just providing you a synthesized place to go and access it all in one spot. So with that being said, we did not conduct a critical appraisal on any of the studies in our database, and we did not screen or assess quality. We just included if they were available because we feel it's important to display all available data just to have that evidence there to use for decision making. That being said, in our database, the data that was extracted from the available studies was extracted and screened in duplicate by our Zero Tracker team researchers who have experience extensively with epidemiological literature reviews. So we do have that level of data checking on our side, but we don't, in terms of the findings ourselves, we can't validate them. As to the second part of the question, which is about real-time updating or how often we'll be updating. So for MERS-CoV studies, seroprevalence studies and viral testing, as opposed to like we saw with COVID-19 seroprevalence, where we had thousands and thousands of studies in a short amount of time over a few years, the studies are published for MERS-CoV rather slower. There's not as many that are published all the time. So we aim to update the database. It will likely be on a possibly annual or biannual basis, depending on how often new data is being posted. We'll be keeping our eye on it closely to inform that. In the meantime, if there are case-by-case new studies that individuals identify or expert recommendations that are sent right to us, they say, hey, we think this should be on your dashboard. Could you please assess it and add it? We can do that on a running overall basis. We are working on some methods at SeroTracker to investigate how we can automate end-to-end literature reviews and speed up the process to get as close to real-time updates as we can while still maintaining a solid scientifically valid process. We have already worked on a screening tool for being able to screen abstracts and full texts that we're excited about, but need to validate further, and hopefully that will be something we can get even better at in the future.
Thank you so much. So Sean, you are the master programmer here. There are several questions on what program and large language models were used to generate the literature reviews and the information displayed in the tracker. So did you want to answer those live, please?
For sure. So large language models were not used for extracting all that data. So what you're seeing were the fields where those were taken from the study. Those were done by hand by our team. So that's how our data got from the studies to our dashboard.
Thank you so much. And maybe over to your team one more. What kind of challenges did you encounter when developing this tool? If you'd like to share with the listeners today.
Yeah. I think it was hard to figure out which visualizations provided the most value. So the visualizations at the bottom you're looking at right now are the ones we decided were the best and kind of provided the most value. I think it's hard to lump all the data together. So I like the drop downs a lot where you can see custom sets of data for what you're particularly interested in. I think we iterated on that a lot, and I'm quite happy with the end result.
Great, thank you. And can you also just mention if there are any prior authorizations or application requested required to download the data by users?
No, you could just go ahead and download the CSV right by the table here, and then there's a little citation. But yeah, this is all information that if you took the time, if you took all these links and did it yourself, you could find this information.
Yeah, our data set is freely and publicly accessible on our website. It's always also available. Same with our other trackers. You can download it at any time. We also have our GitHub repo, I think namely for our SeroTracker, which is also openly available if you want to go and explore that. So yeah, we do very much encourage you to download these sets of data and use them for your own research purposes. And we do have that citation there just in case you would like to reference our protocol or our process or dashboard as a whole.
Great, thank you so much. And I think that's it for the questions. We've tried to answer most of them also in writing, so please do check the Q&A if you left a question and it was not answered live. We are available for you to keep asking us questions offline if you would like, but I think that's all the time we have today. So I'd like to pass back over to Supriya and Sophia for the closing remarks. And thank you again to the panelists for your answers. Thank you.
Thank you, Alice. So we're at the end of our allotted time, and I will just wrap up by saying thank you very much to all of our speakers and panelists today, the WHO colleagues who have worked on this, and the EPI-WIN team. Finally, thank you all for coming and for your active participation through the chat and the Q&A. The recording of this webinar will be available at the EPI-WIN website, and EPI-WIN Digest, a slide set with key messages on this topic, will be published shortly. If you want to keep updated on future EPI-WIN webinars, recordings, and presentations, and the EPI-WIN Digests, please subscribe to our mailing list. Both links are provided on the chat. We hope you will join us for our next webinar on strengthening RCCE response to Mpox outbreak in the African continent, countries experience, which will take place next Tuesday, November 26th. Details are posted on the website and sent to the mailing list. Thank you all again, and goodbye. See you next time.